This Week in Health IT, our last episode of the year, the countdown of our 10 most listened to podcast interviews for 2019. That's right, this week, someone will walk away with the bragging rights for the coming year, the most listened to interview on This Week in Health IT for 2019. My name is Bill Russell, CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events designed to develop the next generation of health IT leaders. Special thanks to our channel sponsors, VMware and Health Lyrics, for choosing to invest in developing the next generation of health leaders. Reminder, we need your feedback. thisweekhealth.com/survey. If you complete the survey, it only takes a couple minutes. Really helpful to me, to the staff, as we try to figure out what is best going to serve the industry and to serve you as our listeners in the coming year. So that's thisweekhealth.com/survey. Before we get started, I wanted to thank everyone who appeared on the show. We had so many wonderful guests volunteer their time, their expertise, their experience and their wisdom with us over the past year, and it is really valued. I just want you to know that I sincerely thank you for taking that time, spending it with me, giving me the opportunity to capture it on audio and video, and then sharing it with the industry to hopefully propel the future health leaders forward as they are thinking about solutions for their communities. So thank you very much. So we're going to get to the top 10. So a few notes about the tabulation process. Time matters, right? So podcasts and YouTube videos are evergreen content, which means something that gets produced in January probably has more of an opportunity to be in the top 10 than something that got produced in July, August, September. So if you're wondering, hey, how did I not make this list? There are some great episodes in the second half of the year, but the evergreen nature of this, I'll give you one example. Every time Dr. Klasko speaks, he gets a bump of about 40 downloads of the podcast or of the video on the YouTube channel. So he's speaking to 1,000 people. They go out and search for him. About 40 of them find the site. They listen to the podcast. And so that's naturally going to drive that up. So someone who is out in the public eye, somebody who we interviewed before July, these are things that matter in the countdown. So just because this is the top 10 for this year, it's a point in time snapshot. I'm sure if we did it at the end of February, it'll be a different point in time. But I'm not taking away. These are 10 great podcasts. So let's just get to it. At number 10, Russ Brand, the president and CEO for Chime, our professional organization within Health IT. Russ has traveled the world, literally has traveled the world over the past year or so, speaking to crowds in several countries and health systems and professionals. In this conversation, we discuss some of the innovations that he's found in his travels.
There is best practice out there in every area, especially this area of innovation or AI or whatever you want to call it, across the globe. If we can just figure out how to leverage what's already been done, never mind what's being worked on, we could absolutely revolutionize healthcare. Even a few years ago, a good example, Jurong Hospital in Singapore went from a materials management department of hundreds of people to advanced robotics delivering almost everything in a department of a few people. Well, that just sounds like, well, we just replaced some people with robots. No, it's advanced AI based. Their materials costs are way down. Their shelf time is nearly perfect. Nurses and caregivers are saying that those are things they don't even worry about anymore. So we augmented the care process and improved it by doing that when one of our members there. Probably some of the most interesting things we've seen, obviously, is what I would call proactive security. And what we've discovered from a innovation perspective, and obviously there are countries like Israel that do this really, really well. Obviously they have to. They have a little bit different security requirement in their country than others. But when you talk to the security leaders that are there, where we talk about stuff of, well, we need to make sure we react to this, or we're monitoring really aggressively, their answer is, we need to catch 100% of everything coming in 100% of the time, and if necessary, fight back 100% of the time. What I love is some of the things that we're seeing in places like the UK, where they're figuring out how to use advanced analytics to help manage patients in what I would call one of the few places in the world that are truly doing it holistically. They've combined health and social care, what we would call mental health care, in such a way that the entire patient, the entire record, everything is being managed from a universal perspective. But not only that, they're proactively looking forward on how to use it from a preventive perspective. Again, they're using advanced analytics, technology, community engagement strategy, consumer strategies. We just don't see that, at least here domestically, quite yet.
Yeah, that was a fun conversation with Russ, and I love what Chime is doing internationally. Look forward to more of that in 2020. You're going to hear me say that a lot. I'm looking forward to more of that. These are, 10 great podcasts. At number 9, Carina Edwards. Carina Edwards is a rock star. If you don't know her, she was at Zincs, then she was at Imprivata, and instrumental in growing the work at Imprivata. And this past year, she took over as the CEO for a cool digital startup called Quill Health out of Philadelphia. And it's a combination of some work from Independence Blue Cross out of Philly and Comcast, NBC. And they brought her in. She's now the CEO. And we had a great discussion. In this clip, we talk about the foundation for digital, and that's really data and data liquidity, and the promise of digital, which is personalization. Have a listen.
And now I think with 21st Century Cures Act and TEFCA going to legislation, we have the right as patients to make our data portable, right? And so that's step one. And
Yes.
so now that I can get, with Blue Button paving the way, I can bring my data into an app when I consent.
Yeah.
I can also consent to share my information with others. And now you have a digital ecosystem with you and your support team. Some people call them caregivers, whatever name you want. These are not the clinical professionals that care for you. These are your niece, your nephew, the friend that's going to take you to the appointment. Now I can see with those feeds, I can see schedules, I can see medications, I can see claims data, and from that I can share with you a comprehensive recommendation of what to do next, not just on the journey you're on. So in the current pilot that we have now, we have some patients that are going in for a hip replacement. Great, full stop. Now you add to that though, their BMI is 40 and they're a smoker. So before we get them on the table, can we also get them to potentially change some behaviors in the next 7 to 8 weeks that will make them better for that encounter and get to the better outcome? And I think finally our incentives are aligned, because now with value-based bundles, right, the risk lies with making sure that patient is well. If they get readmitted, then I hold the cost for that. So what can I do to drive adherence, education, and really then get through this journey together and get them to the healthiest version of themselves? Because it's not about everyone needs to go climb a mountain. And so this has to be innately personal, right? When you think about the content, I had a friend who was going through a hip journey, so I said, please use Quill, give it a shot, give me a ton of feedback. And his best feedback was, stop showing me 80-year-old women in walkers. I'm going to be back on the golf course soon. And I said, fair point. And so I turned to the team and I said, what can we do for customization and personalization? And so within a month, we've now tagged all of the content, and we've actually done a demographic tag. And so literally I can present to you based on your goals. What are you looking to achieve? Are you looking to play with your grandkids? Are you looking to run a 5K? Are you looking to get back to a marathoner? Everyone has a place they want to start and where they want to go.
Wow, there were so many insights in this podcast. It was hard to pull just one clip. I would encourage you, as with all these, but this one, I would encourage you to dig it up and have a listen. A lot of great conversation on that podcast. So the coming in at number 8 is one of the good guys within healthcare. Drex Ford and I sat down and discussed the announcement of Haven, which is the Amazon Berkshire Hathaway JP Morgan joint venture. Drex is a great guest. Similar to myself, he's an independent consultant, so he travels around a lot, gets to talk to a lot of different people, interact with a lot of different health systems. So I try to have him on a couple times a year and just try to catch up on different things. And a lot of times we talk about the news, things we're sharing in our feed, and those kind of things. I know that this episode got a majority of its listens because we talked about Haven, but as I was listening to it again in preparation for the show, I found, a clip which I quite frankly, I thought was more interesting from that show. And we talked about an article that he shared in social media about how the EHR was having mixed results in rounding at different health systems, and it had 4 reasons for that. And we went back and forth a little bit on it. So have a listen.
I thought the same thing when I read the article. I don't know that any of those things surprise me. I think the real sort of takeaway in that is our inability in healthcare to yet create clinical standard work around the use of the electronic health record. So we've, to sort of turn a phrase, we've kind of paved a cow path instead of sort of saying we're going to do everything a different way. So now that we're using EHRs, and that means we're going to change the way we do morning rounds so that we can integrate the EHR more effectively and not do workarounds. That creates a whole group of risk in and of itself for patients and families. And none of us really want that. But I think we've still sort of got this weird situation where we have clinicians and others who are unwilling to change and unlearn the habits that they already have about how they do morning rounds and other clinical provision of care too. But in this instance, particularly around morning rounds, they're unwilling to sort of change their ways of doing it to integrate the EHR more effectively. And then I think the other part of that is sometimes the EHR doesn't work very well to be able to facilitate the work that they're trying to do too. So it's really sort of two different pieces of this. One is a management engineering effort to make sure that we're using the EHR as much as we can in the workflow and that the workflow has been modified to adopt to the EHR. And the other one is changing the EHR and doing the informatics stuff that we need to do to make sure that the right data is available when it needs to be used in morning rounds.
There you have it. Coming in at number 8, Drex DeFord. As I said, one of the really good people within health IT. Regardless of what Wes says about him, and the good news for Drex is that Wes's episode is below Drex's, so at least within the two of you, you have bragging rights for the coming year. Following the Epic UGM meeting, I keep calling it a conference, it's a user group meeting. Following Epic UGM, I caught up with Dr. David Butler to get his thoughts around the meeting. He was in his bell bottoms, he was still hyped up on caffeine, and and quite frankly, we caught him on the way to the airport, so he was sitting on the side of the road. Maybe next year we can catch up to him in person and not as frenzied a conversation, but again, I think he captured really well the essence of the UGM meeting in this short clip. So coming in at number 7 for 2019, Dr. David Butler, Principal and Chief Digital Officer for Helix Partners from Epic UGM. And so some of the patient-centered things that I'm picking up on are, Epic's Happy Together Unified Patient-Centered View of MyChart. You had MyChart estimates. You had Care Everywhere, patient-initiated sharing of the record. I'm just throwing out some of the things. Were there some other things that they did that you heard that you were like, yeah, they're really making movement around this, around patient-centered, around helping health systems to be more patient-centered?
Yeah, I think you totally rattle off the big ones, and those are a lot of sometimes I call epicism, some of those words, and so non-epic clients may not know what that means, or even patients that may be listening. So yeah, putting the care into the patient's hand is what it's about, and that's where it's been about. And so where if you have 3 different records, like for example, I moved over 4 states, me and my family, for various jobs. I have about 5 different MyChart accounts now. One click, I can now see one patient portal and all my data. And if I go to a doctor somewhere and that doctor does not have Epic, it could be a medical care, it could be a urgent care. I can now with Share Everywhere, I can give them a code. They'll log into a website, not a patient portal. They can log into a website, put in that code because I've given them access to my notes or whatever they need, if they need that. So I think that has been the biggest, one of the bigger deals, innovations that I've seen in over like 10 years dealing with Epic, as far as on the patient side and without much build or effort on the client side. So,
all right, 2019 was a breakout year for This Week in Health IT, and I'm going to take a couple moments within this show to share with you where we've been and where we're going. Our mission is to develop the next generation of health leaders, and we do that by amplifying great thinking, and that's why we do the interviews, it's why we do the podcast, and it's why we're going to do some collaboration events coming into 2020. with that in mind, our goal was to get this, to amplify great thinking, to get this thinking in the hands of as many health IT professionals as possible, people on the front lines that can make a difference. And by our measures and by our goals, we exceeded every goal that we set for this year. We had 100,000 audio downloads of the podcast. We averaged in Q4. Here's a couple things we did. We averaged 2,700 downloads per week, 154 hours of watch time on YouTube, and 10,000 page views on our website. We really revamped our website towards the second half of this year. Quite frankly, it was pretty lame in the beginning of the year, and we're going to continue to do that. And that's one of the areas we're going to use our sponsor money is to make that content more accessible to more people. We also had 200 new subscribers since July to our email services. We have a couple of those that we send out. So our accomplishments for this year: we piloted a virtual summit. We had 100% NPS on that, and I'm looking forward to rolling that out in 2020. We created guest profiles on the website, thisweekhealth.com/guests. Easier way to navigate. If you have a favorite person that you follow or are interested in, you go to that site. All the pictures are there. Click on it, and then underneath that, a lot of them have a profile. I'm a little behind, but a lot of them have a profile, and those that don't have a profile, it will have the episodes that they appeared in. We launched a weekly news show, and then we revamped it twice this year. The most recent time we revamped it, what you said to me is you wanted me to take the top 10 stories for the week. I'll be shocked if there's 10 stories every week, but there has been so far. So top 10 stories and tell you why it's relevant to health IT, and then circle back and go a little deeper on one or two of those stories. So we started that new format probably in November. And again, the feedback on it so far has been pretty good. We launched Staff Meeting, which is designed to help you get the conversation started on the right foot. We take little longer clips from these interviews, and then we put some questions around it. So you could give this to nurses who want to talk about security or those kind of things. They download it, they watch it, and then it just has 2 questions to get the conversation started. And then we launched Insights. Insights is really about personal development. So we're taking shorter clips and we're putting some context around it of how health IT professionals can apply some of the things that we talk about on the show to develop their career and to advance their work within the health system. All right, back to our countdown. Number 6. This is a podcast, as I mentioned earlier, that I expect to climb. I sat down with Nasser Nizami and of Jefferson Health, CIO for Jefferson Health, and Dr. Stephen Klasko, the CEO for Jefferson Health, on one of my trips to Philly. In fact, 2 of our top 10s from that trip are from that trip to Philadelphia. Carina Edwards with Quill Health, and now this interview with the people at Jefferson Health. And as I said, every time Dr. Klasko speaks, we get a spike on the number of downloads on the podcast and video. So I imagine in no time this will probably surpass all the other podcasts, just because he speaks an awful lot and because he's very provocative. He makes statements that cause us to think and cause us to have conversations, which is why I really enjoyed this conversation. He's challenging the age-old truths that we hold on to and to a certain extent hold us back. Here's a clip that I think really demonstrates that.
I'm old enough to remember when EMRs were just starting, and the Epics of the world, the Allscripts and Cerns of the world will come to us and say, we want you to help us develop. I said, we're fine, our handwriting is fine. The same thing happened with telehealth. People are mailing it in and saying, oh, I just got American Well, Teladoc, MD Live, so some person in Ohio can answer, and I can say I'm doing telehealth. We took a totally different approach, and one of my mentors, and actually our commencement speaker this year, has been John Scully. He said, stop talking about telehealth. He said, we don't talk about telebanking. We don't get up in the morning and say, I think I'm going to telebank. It's just that 90% of banking went from being in the bank to being at home. The same thing's going to happen. So the question for you, Steve, is what technologies can you use to have more and more and more things for the patient happen at home so they don't have to see you? And that's how we view things. We have 24/7 telehealth virtual triage. Now here's the problem. Once you get to that, it's going to become painfully obvious that if you're a provider, you have to be a payer also. And I'll give you a real live example with our virtual triage. Mm-hmm. Given our sophistication in telehealth and IT, We're now at the point where we get 60% of our patients, non-trauma, non-ambulance, out of our expensive and efficient ED, and we have about 500,000 patients come to our ED. Problem is, I make an average of about $89 through urgent care or telehealth or an appointment next morning, an average of $1,400 if somebody walks into my ED that the insurers are happy to pay. We have 32,000 employees now, Bill. So what we said is, with our TPA partner, Aetna, we said, for our 32,000 employees, if you show up to our ED and you haven't gone through Jeff Connect, virtual triage, $500 deductible. If you end up in our ED through Jeff Connect, $0 deductible, including $0 deductible if you end up getting admitted. That's really changed behavior. So there's a great Upton Sinclair quote: it's hard to get somebody to do something when their salary depends upon them not doing it. And we do so much of that in healthcare. And I think it's especially true when you talk about population health. You're sitting here in Philadelphia with 5 academic medical centers, 2 in the top 25, us and Penn.
Yep.
And we have the greatest discrepancy in life expectancy of any city in the country.
Based on zip code?
Based on zip code. So a baby born today at Jefferson that goes to 19147, which is about 3/4 of a mile from here, will live to 2104. A baby born today that goes about 3 miles north of here, North Strawberry Mansion, will not make it to 2090. That's a year less than Iraq and Syria. So while we talk about meds and eds in Philadelphia, we've failed. And the simple answer is that 80% of a person's health, as much as we hate to admit it, has nothing to do with a doctor or the academic medical center or the research that I'm doing here at Jefferson. So that's why that whole, B2B to B2C model becomes so important. You know who the greatest percentage of users of Jeff Connect, our telehealth program, are? Is this situation we have with a homeless shelter. Sister Mary is one of the largest. Why? Because if you think about it, most of them don't have cars. They're housed in this great thing called Project Home. If they have cars, gas is expensive, but they have phones. And they want their families to be healthy. So I think we just haven't come close to pushing the envelope of getting away from, I'm just going to get this company so I can say I'm doing stuff, versus really believing you want to do it.
Yeah, thanks to Nasser and Dr. Klasko for really a thought-provoking conversation. I love the CEO-CIO dynamic on the show. It was a really good back and forth. If you get a chance to watch it, the two of them talking about fire, interoperability, telehealth, and other things. It was good back and forth. I'd love to do more of those shows next year. So if you're a CIO who wants to come on the show and you're not sure whether I'll have you on the show, get your CEO to sit down with us, CEO, CIO. I love that conversation because we can talk about the strategic application of technology within your health system, and we can also talk about specific projects that you have been successful at in your community in taking that forward. Already what I'm seeing on the end of your survey is that people want us to start to elevate some of those stories where people have been successful so that they can implement those things. All right, so our next one, that was number 6. Our next one, so Fortune Magazine wrote an article this year, and everyone who's in healthcare is aware of this article. It's called Death by 1,000 Clicks, Where the Electronic Health Record Went Wrong. And, we talked a lot about this. As soon as I read this article, I knew I had to talk about it with a clinician, somebody who's been in the trenches, somebody who's implemented EHRs at multiple systems. And so I called my friends at Starbridge Advisors who do consulting work across the board, and I knew they'd have somebody I could talk to. And they connected me with Nancy Beal. So this is the first time Nancy and I met was on this show, and she was a phenomenal guest. She's a registered nurse, NYU. I think she was at Children's in Ohio, a children's hospital in Ohio. So she'd implemented a lot of EHRs, very familiar with the process, very familiar with the article, and we just dove right into it. It was really good. So in this clip, I asked her, what a system can do to address the unintuitive, these are words straight out of the article, unintuitive, clumsy, and hard to navigate EHR. Have a listen to this clip from our number 5 most listened to podcast for 2019.
I think there are 3 things really: design, implementation, and optimization. And what successful organizations that I have worked with do is really ensure that they have highly qualified clinicians engaged in the design process. And when I say highly qualified, what I mean by that is not just somebody who might be available who happens to have RN or MD after their name, but actually somebody who understands technology and has some level of experience and or education with technology. So I really believe that clinical informatics is crucial in appropriate design. Likewise, those same clinicians are essential when it comes to implementation strategy, spotting where the problems are, identifying the folks who are really struggling, how do we solve those problems, or identifying what could be really dangerous situations that are occurring that otherwise you may not know because you don't have that clinical connection. And then ultimately optimization. You know, one of the things that really encourages me to be interested in pursuing how we measure technology adoption and putting some standardization around that is that we continue to develop all these really wonderful technologies, and some are integrated and some are not, but we put some of these things out there and don't always measure how they're being used and if they are in fact being used as intended. And one of the challenges with that, of course, is if you have workarounds that are occurring, there could be downstream implications of that, and in fact, even patient safety implications of that. So really optimization, going back after the fact, making sure that what you implemented is actually working, and if it's not, how we make it better.
Yeah, I want to thank Nancy for coming on the show. We tried several times after this recording to get together and have been unable to at this point, but I would love to have her back on the show to have further conversations. So we'll see if we can make that happen. We'll get back to our show in just a minute. As you know, Health Catalyst is a new sponsor for our show and a company I'm really excited to talk about. In the digital age, cloud computing is an essential part of an effective healthcare and precision medicine strategy. And we've talked about it many times on the podcast. But healthcare organizations themselves are still facing huge challenges in migrating to the cloud. Currently, only 8% of EHR data needed for precision medicine and population health is being effectively captured and used. That's 8%. One of the things I like about Health Catalyst is that they are committed to making healthcare more effective through freely sharing what they have learned over the years. They published a free ebook on how to accelerate the use of data in the delivery of healthcare and precision medicine. You can get that ebook by visiting thisweekhealth.com/healthcatalyst. And this is a great opportunity to learn how a data platform brings healthcare organizations the benefits of a more flexible computing infrastructure in the cloud. I want to give a special thanks to Health Catalyst for investing in our show, and more specifically for investing in developing the next generation of health leaders. Now back to our show. Okay, we're at number 4. The fourth most listened to podcast for 2019 is a former CIO and someone who made the move just now in 2019. Actually, not too long ago, now that I think about it. Dr. John Halamka is now the head of platforms for Mayo. And we sat down following the HIMSS conference to talk about this patient-centered interoperability, among other topics. Here's a clip from that conversation.
So I will take your theme of using natural language processing, AI, machine learning to craft a less burdensome clinical experience to even tell you about a larger trend, which is machine learning not going to save us all, right? Got to be very careful about that. I wouldn't want to criticize any particular company's marketing strategy, but the likelihood that Dr. Watson is going to read 1,000 articles and treat you tomorrow with no human intervention isn't happening in the next 6 quarters. Right. What's happening in the next 6 quarters is I can say, oh, I have studied 1 million patients like Bill. And what I know is that I can improve Bill's lifestyle if I make these 2 or 3 interventions, if I offer these 2 or 3 incentives, and that kind of thing. The patients of the past informing the care of the patients in the future gets us closer and closer to a personalized medicine approach. We're already deploying 12 such projects at Beth Israel Deaconess. And it's simple things like, how do I schedule the OR? Who's going to show up to the appointment? How long are you going to be in an inpatient setting? And maybe we can schedule all the events in a Gantt chart and not randomness. Or how is it that I can figure out for the wellness care that is going to reduce total medical expense and improve quality, that I can put you through the right preventative rather than, curative kinds of measures? All these sorts of things we're doing with existent 11 petabytes of patient-identified data hosted at Amazon Web Services, Google Cloud, and other places under BAAs to figure out the possible. And it works.
I'm pretty sure no one put on more miles last year than John in pursuit of innovation in healthcare. I really am excited that he's joined Mayo, and I no pressure, but I'm really expecting great things from them in 2020. In our top 10, we have 2 acting CIOs. They're both with new organizations in 2019, but they are 2 acting CIOs, which is fantastic. The next one is someone that I think is a really great thinker in the space, in the digital space, and also gets the conversation going with really provocative statements. Jonathan Maness is the CIO for Christus Health, and we sat down to talk about the digital hurricane. He had brought this up maybe a year and a half, 2 years ago, maybe 3 years ago now that I think about it, at a conference, and it stuck with me. I downloaded the presentation that it came from. I've talked about it with several people, and I thought when John came on, I thought this is a great opportunity to talk to him about digital, and specifically the digital hurricane, and how industries go through this change that digital brings upon them. So in this clip, John and I discussed the impact of digital on healthcare.
Where do you think we're at today with healthcare in terms of this digital hurricane?
Well, I think we're still on the outer bands, and we're fighting it tooth and nail to not get towards our digital destiny, as it were. I think we are in many ways a lot like other industries who just can't seem to let go of our current model. We've got so much invested in terms of capital, in facilities and brick and mortar buildings, in an old operating model, in an old clinical delivery model, and we don't know how to let it go. And we are doomed to failure if we can't let go of the things that have made us successful for many years in order to be successful in this new environment. And there's no question in my mind that I think about the millennial generations, the Gen Xers, the folks who are being born even today. They're a very different breed of people. People want to know, why are we on the outer band of that hurricane? And it's because we haven't had to change. And nowadays, in modern life, there's a different expectation for service, and people want to be serviced. There's an immediacy expectation. They want to be serviced when, where, and how they want to receive services. And they frankly don't care about the convenience of the supplier. It's all about the convenience of the customer. And we have been very slow as an industry to realize that.
There it is. That's the number 3 most listened to podcast for 2019 with Jonathan Maness, the CIO for Christus Health. Realizing our digital destiny. Those are the kind of phrases I just love. Realizing our digital destiny. It is our destiny. It is what's going to happen in healthcare. It's just a matter of when are we going to embrace it, and how are we going to get from where we're at to that point in our future. So we're getting close. We only have 2 spots left. Before we get there, I want to talk about 2020. I want to talk about where we are going as This Week in Health IT is going in 2020. So this past year we launched Insights staff meeting. We piloted virtual summits. All of those are going to continue in 2020, and we're going to expand those in 2020. 2 main things, really 3 main things I want to talk about here. One, I want to partner more closely with health systems. If you have thoughts and ideas of how we could partner together as a health system and the show in terms of developing content and bringing content to your staff to help them to stay current and to develop so that they can serve the community and serve your health system better, I want to talk to you. So shoot me a note, Bill at bill@thisweekinhealthit.com. And let's have a conversation. I'd like to know how we can do that more effectively and how we can help you. Because one of the things I am aware of is, budgets are going to get tighter. And the first thing that goes is travel. And the second thing that goes is training. And we cannot afford to not develop our people. And I want to help you to develop your people and to continue to move things forward within your health system. Keep them current and keep them exposed to some of the great work that's going on within the industry itself. So that's the first thing. I want to partner with health systems. The second thing is that we are going to be, so there's two things in terms of production. The first is, if you are thinking, hey, I want to do a podcast around the health IT and the delivery of healthcare, then I'd like to talk to you, because I think we can help. A lot of people are sitting back and go, I've got a great idea. I want to launch a podcast. I don't know if I can do it as often as Bill does or whatever. That's really fine. What we'd like to do is we'd like to support you in that. We offer production services, we offer tutorials, we offer coaching, and we'll even offer our platform to highlight and to host your shows on our website going forward. So if you're thinking, I have an idea for a great podcast, I would like to develop content that will help to develop the next generation of health leaders in whatever area. I'd love, work in, you could focus in on a specific space within healthcare. That would be great. I'm going to continue doing the two shows, the news show and the interviews. And if you're doing something that is complementary to what we're doing that develops health leaders, I want to talk to you. Bill@thisweekinhealthit.com. Let's start a conversation and see where that goes. And then finally, I can't be everywhere. There were a bunch of conferences I wanted to go to last year that I couldn't go to. And, one of my friends introduced me to this concept of ambassador. I know I'm not the first to do it. I know others have done it, but I would like to start training ambassadors. So if you're going to conferences and think, hey, I could do an interview like this with a phone and with a mic, that is true. You probably could do it. I'd like to talk to you about if you could be an ambassador for This Week Health events, so that we can cover more of the shows that are out there. So again, those three things: partnering with health systems, hosting new podcasts and helping you get them off the ground, and then the ambassador program. Bill@thisweekinhealthit.com. So that's it. We made the show for healthcare by healthcare. So we are healthcare leaders helping and supporting other healthcare leaders. Okay, we are now at number 2. And, I'm fond of saying that buzzwords in the hands of the wrong people remain buzzwords. But buzzwords in the hands of the right people, it's magical. It's exciting. When the right people are working with the really cool technologies, it sparks your imagination. It makes you think of what's possible. And it gives you hope of what's going forward. And one of those people comes in at number 2. It's the VP of R&D for Epic, and that's Seth Hain. And I loved the conversation. We just went back and forth. He told me about all the things that they're looking at and they're doing. And then he got into really where it's being applied. And in this clip, we talk about how they are helping even the smallest rural hospital and health system apply AI to the challenges they face.
A couple come to mind. The first one is North Oaks, an organization down in Louisiana. And they're actually one of the organizations, they're a community hospital down there that has at this point adopted over 10 models from our machine learning library. They saw a 40% reduction in codes outside of the ICU by implementing deterioration models, which really are a way, if I'm thinking about it from the patient perspective, I can be confident when I'm either, maybe unfortunately in a on the med-surg floor, or a family member next to somebody that's at the hospital. I can know that as those monitors at the bedside are collecting information, the system is running in real-time analysis of that information along with my longitudinal chart to understand my risk of, say, hospital-acquired infections, deterioration in the context of North Oaks here, early onset of sepsis, and then alert individuals, maybe say in the ICU, that I need some intervention and somebody to come check on me. So North Oaks certainly stands out as one example.
So let's stop on North Oaks real quick, because that kind of surprised me, that you started off with a community hospital in Louisiana. You know, you would think that the organizations using this are in, you know, in Seattle or LA or San Francisco or Chicago. But you're saying that, you know, even the small hospitals have access and the benefit of utilizing these models. Is that because you're packaging them up in a way that they can just implement them out of the box?
Yeah, and that's the key to those two approaches that I spoke of earlier, right? The library enables organizations to quickly begin implementing and using those models in their existing workflows. And the underlying platform provides them the options to do that cost effectively. It's cloud-based. So as they need resources to localize or retrain models to their particular populations, they can spin up those resources in a public cloud, train those models, and then implement them directly back into workflows without needing to bring all that infrastructure in-house. So yeah, our goal is really to help organizations of all sizes. I grew up in a small town outside of Lincoln, Nebraska, with a community hospital, right? Help organizations like the community I grew up in be able to implement machine learning for all patients.
Yeah, that was a great conversation, and one that makes me optimistic about the future of technology in healthcare. We're here. We're at number 1. But first, let me count them down for you. Number 10 was Russ Brand. Number 9, Carina Edwards. Number 8, Drex DeFord. Number 7, David Butler. Number 6, Stephen Klasko and Nasser Nizami with Jefferson Health. Number 5, Nancy Beal talking about death by 1,000 clicks. Number 4, John Halamka. Number 3, Jonathan Maness and I talking digital health. And number 2 was Seth Hain, the VP of R&D for Epic. So have you figured out who's number 1 yet? Do you think you know who's number 1? It is a CIO. It's an acting CIO. The most listened to podcast for the year comes from the CIO of Providence St. Joseph Health and former Microsoft executive BJ Moore. BJ is one of those CIOs from outside the industry that is really challenging the status quo. He really makes no bones about it, and he's unapologetic about his lack of healthcare experience. I love the conversation we had, and I found a lot of this conversation to be really extremely refreshing and thought-provoking. Here's a clip from our most listened to podcast for 2019 with BJ Moore, the CIO of Providence St. Joseph Health out of Washington.
Well, first, some background on what I did at Microsoft. So I was responsible for all of our commercial revenue systems, so a $70 billion business. And you asked earlier why I decided to leave Microsoft. One of the reasons is I completed our cloud journey. I was happy to say, as of last October, I'd moved this $70 billion business to be 100% on the cloud, not a single asset on premise. And so to play it forward to what I expect to do at Providence, I expect to do the similar thing. We've got various data centers, all 4,000 of these applications are hosted on-prem. We haven't leveraged any of the cloud services. So the journey as I see it today, again, 3 weeks in, I need to learn more is really getting out of that data center business, getting out of the business of hosting our own applications. And that isn't going to just be taking these 4,000 applications we have and moving it to the cloud. First thing it's going to be to simplify this environment significantly. And so instead of moving 4,000 apps, maybe we move 1,000 applications off premises and into the cloud. It's going to be using, infrastructure as a service, probably primarily lifting and shifting these applications to the cloud. On the data front, we talked about that. Our data strategy is going to have to include big data and leveraging the platform as a service that the cloud offerings, have, either Amazon or Microsoft, and really have a sound data strategy around that. And then adopting software as a service. And so we've selected Oracle Financials that are in the cloud as our ERP. And so in the case of ERP, we'll get away from on-premises altogether and move to a software as a service model with Oracle. So what it looks like to me is, I don't know how long that journey takes, 2 or 3 years, but we're either all infrastructure as a service, platform as a service, or software as a service. And this concept of hosting these applications on premises just goes away.
Yeah, so
that's my whole vision. My team looks at me like I'm crazy, But if I can move a $70 billion, and nobody would accuse Microsoft of having a simplified business model, if I could do that already, I feel at least I've got the chops to do that with somebody.
That's it for our top 10 for 2019. Going through this list gets me excited about where we've been, but what we are going to be able to do in 2020. 2020 is going to be a great year in the application of technology in the delivery of care and health. Thanks again to all of our guests for 2019. I really appreciate your time, your dedication, your expertise, and sharing that with the community so that we can advance health really across the globe. Your time really makes this show possible. Thank you for our sponsors. Your investment in developing the next generation of health leaders is greatly appreciated. And I look forward to what we can do in 2020. This show is a production of This Week in Health IT. For more great content, you check out our website at thisweekhealth.com or the YouTube channel. Thanks for listening. That's all for now.